I'm going to bust some myths about what are some of the hidden causes of pain that neither you nor your doctor may know about. I'm going to list top 5 reasons of pain that you need to know about, and so that you can know how to fix it. I'm going to even give you some solutions with that. Here we go, everybody. Hey everyone, I'm Maggie, UMD. I'm a functional and holistic medicine physician, and I am the owner of Transform. We have a Facebook group, Transform Autoimmune Disease Naturally, on Facebook, which is about almost 37,000 members strong. So if you haven't joined it, make sure you join it because there's tons of content in there. If you are watching from YouTube right now, help us out with the algorithm gods and go ahead and click a like and click a subscribe. And I will have a quick introduction. I have a sidekick with me today. I'd love for Amanda to introduce herself. A lot of you already know her from the Facebook group. She manages our Facebook group. Mandy.
Hi, guys. I interact with a ton of you in the Facebook group. I love seeing your comments. I love seeing your questions. So I'm really excited tonight to just get to work with Dr. Maggie and kind of read some questions. So please ask all the questions. She's here. Let's get it answered.
Today, we're going to unveil the top 5 hidden reasons for pain in autoimmunity that even you or your doctor don't know about. And we're going to go through how to fix some of those causes also. Of course, what I love to talk about too is that I don't think that pain happens by itself, meaning like, why is it that somebody can get an injury from something and heal within a couple days or a couple weeks, and yet another person can develop chronic pain syndrome, and that's a known trauma or trigger to it. But then there's also all these reasons where there's no trauma involved. You're just in pain, right? And what are some of the mechanisms that's causing this rando pain? I call it random acts of health violence. Without further ado, I'm going to actually talk about what is number 5. What is the number 5 reason that people have pain? And this is going to surprise you. Blood sugar problems. It shouldn't surprise many of you in the Facebook group or who's been following us on the YouTube channel. I think blood sugar is the holy grail in actually calming autoimmunity because it is actually one of the biggest perpetrators of autoimmune hell. And I don't care if the symptom is pain or if insomnia, if it's mood, if it's whatever it is, blood sugar is at the bottom of this. I am telling you right now. Many people joining our program, any of our programs, whether it's My Hormone Masterclass or our main Transform Autoimmune program, they'll come in the program saying, I got blood sugar licked. And I'm like, and Mandy knows. And then at the end of the program, when I asked what was the most impactful surprise for you, almost 90% of people will say blood sugar, if not 100%. So why is blood sugar so important? Now, if you guys have alumni personal experiences with blood sugar and pain, put it in the comment section. Those of you who you're not in our alumni or in our programs, but you already suspect blood sugar is playing a role, I'd love to hear some feedback from you. Talk with me. I don't like talking with you. I don't like talking at you. Talk with me. So let me know. So mechanisms, blood sugar is that people with autoimmunity are much more prone to blood sugar swings, not just high blood sugar, but also low blood sugar. And it is the swing between high and low to high that triggers a lot of hormonal changes, liver stuff going on. There's a lot of processes that happens every time high goes to low and low goes to high. Okay? And I'm going to share with you one mechanism that happens that causes pain. When you go from high to low, it triggers what we call an adrenal cortisol surge. Cortisol is a hormone that's, yes, you need a low level for it for metabolism, maintenance, but when your body thinks you're dying, it's going to raise cortisol like crazy, which then can convert into adrenaline. Okay? Now, data after data after data is showing that elevated levels of cortisol and this fight or flight response, okay, elevated levels of cortisol triggers pain, trigger tons of mechanisms for pain. So what are you supposed to do with this? This is why blood sugar mastery is huge in our program, Transform Autoimmune. It's also huge in My Hormone Masterclass. And what I find is if there are certain things that lifestyle-wise and habits wise that you can absolutely do to actually, instead of having high low all day long, you're stable all throughout the day, therefore preventing the high and low swing and preventing cortisol surges. That's going to be really important. It's going to be regular eating throughout the day, very balanced with protein, fat, and complex carbohydrate like fiber. So lifestyle standpoint wise, definitely that's going to be something.
Yeah, we have a great question. What if you don't have diabetes? Does blood sugar still apply to you?
That's a great question. Okay. So, by the way, all of you that are diabetes or pre-diabetic, diabetes is an autoimmune disease. Yes, because that blood sugar problem is actually related to autoimmune attack against your pancreas. Yes. So here's the thing. There's a big misconception out there that unless you're a diabetic, you don't have a blood sugar problem. And I'm going to call bullshit. Bullshit. And the reason is that it's not just high blood sugar that's triggering this problem. Did you hear me say high to low and low to high? So what I have found is that, and we'll tie hormones in later, but the hormonal changes in people with autoimmunity really makes us more prone to low blood sugar just as much as high. So you don't have to be a diabetic to have low blood sugar, do you? And you don't have to be a diabetic to have high blood sugar either. You don't have to have crazy ass high blood sugar like 200-300. But even if you go from a blood sugar of 120 to 60, which is really in the normal range, but because you're autoimmune and that swing can happen within sometimes 20-30 minutes because we're more prone to it, even just going from 120 to 60 or 60 to like 150 will trigger a lot of these cortisol mechanisms and will trigger the low blood sugar, like literally shutting down of all your hormonal systems. We are very sensitive to high and low blood sugar. So it doesn't even matter to me whether you're a diabetic or not. That has nothing to do with it. If you have pain or you have autoimmune disease, you got blood sugar problems. So great question. Some people sometimes ask me, it's like, well, okay, so if I'm trying to eat regularly throughout the day, are there supplementation that could help out with balancing blood sugar? And I'm going to point you guys to a lot of different videos. In the Facebook group, we have a section called Guide. And if you list right now that you want the blood sugar guide in the comment section below, check your messages later because our team will be dropping those resources in your message request section of your Facebook Messenger. So make sure to check your message requests because we keep dropping resources and many of you don't even check your messages and see those resources. Balancer is my go-to. We use Balancer all the time in our program for people with PCOS, people who are pre-diabetic, diabetic, or anyone with autoimmune disease that struggles with blood sugar issues. That means all of you. So I love Balancer, and there is a video specifically about Balancer and the active ingredients in it and why it's so helpful for balancing blood sugar. So I do 2 Balancer in the morning. The other one, Golden Balance. If you guys haven't seen the videos on Golden Balance is amazing because and you'll see why. There's a whole video around how I use it in my warm foamer frother and why I drink it every single night. I had it last night, in fact. Ending your day with Balancer is going to be really, with Golden Balance is really great for balancing blood sugar as well. So some supplementation tips on that. But balancing your blood sugar throughout the day is going to be really important to keep the cortisols from surging. So you want normal levels of cortisol. You don't want crazy ass because that's going to trigger crazy ass level of pain. And some of you will notice that certain times of the day, your pain's going to be worse. So some people notice pain's worse in the middle of the night. Guess what's happening? Low blood sugar. Some people will notice when they wake up, they're in worse pain. And then some people, late afternoon, they get their migraines the worst. What's going on? It's blood sugar, baby.
Question, how do you control your swings in blood sugar if you take steroids daily?
This is a really great question because, you know, those of you, and tons of messages coming in YouTube too. Thank you. We'll get to those YouTube questions too. But certain medications that we take actually exacerbate, meaning make worse our blood sugar problems. So think about this. Even if you're a diabetic per se, and you take metformin or you take insulin, yes, that actually deals with high blood sugar, but can it crash your blood sugar so you crash into low blood sugar? And then does it make the swing worse? Yes. So we have what I call iatrogenic, meaning created by doctors of medicine episodes of high and low blood sugar. Prednisone is another great example. Prednisone, frequently used in autoimmune disease to really suppress your immune system. And we can go on and on. I can go on and on about how bad chronically taking that medication is. But at the same time, sometimes it's necessary. But one of the major side effects of prednisone is it raises blood sugar. Huge. big time. So that's the mechanism to why people, when they take prednisone, can have plenty of side effects, can affect mood, energy, and irritability. And long-term use of prednisone can actually make you look like you're a diabetic on all your blood work because you're chronically having high blood sugar. It is very difficult to try to get off prednisone if you don't actually attack what is causing autoimmunity. So for me, it's like people want to get off. I get it. But to me, the only ways you're going to get off of it is you actually look at every pillar of a program, calm the autoimmunity, then that sets you up for success with getting off prednisone. But in the meantime, people on prednisone and medications that manipulate blood sugar, it's really important even more to actually really learn, how can I balance my blood sugar on prednisone, on diabetes medication, so that I set myself up for success. And that's some of the lifestyle things that I've talked about in many of my videos, but that's also the supplementation that I'm talking about. Balancer is going to be in the morning. It's going to be really important too in the morning. Golden balance at night is going to be really important. I really would, if you want some of those guides and resources, put it in the comment section and then check your message request. Our team can message you with that. And things I'm talking about with you, I didn't learn any of this in medical school, and 80% of it I didn't even learn in medical training, and maybe 50% I learned it in my functional medicine training. The other 50% of all the bombs, the truth bombs I'm dropping, is literally personal experience from me and from dealing with thousands of clients over the last 13 years and learning from them. So this is really experience gold that I'm distilling, and I hope that it's helpful for some of you.